All right, so we're going to go over how to assess reflexes in the context of a lumbar spine patient. So we're looking at lower extremity reflexes, which you've done before, but when we're doing these on a patient who's got lower back pain or maybe even radiating leg pain, they're most comfortable typically in a supine position, so this is a little bit different than what you've done historically. So we start with the L4 neurological level. That's going to be the Patella tendon reflex. So the way we would do that in the supine position would be to bend the patient's knee, and you can either use your thigh or even a bolster underneath the knee, so that we get a little bit of stretch on the patella tendon before we tap with the reflex hammer. To locate the tendon, you can ask your patient to just gently try to straighten out your knee against my resistance. Good. Locate the tendon and then tap it with your hammer and grade your response. What I would then do is immediately go do that on the opposite side so that I can compare the briskness of the reflex on one side compared to the other. For the sake of the video though, I'm just going to show you each of the reflexes on one side, but again, once I do patella reflex on one leg, I would immediately then go do the patella reflex on the opposite leg. So the next reflex I would test would be the hamstring reflex, which would be the L5 neurological level. So I could ask Nick to try to bend his knee against my resistance a little bit. So try to bring your heel towards the bed. Great. So I'll palpate the hamstring tendons. And then in order to get enough stretch on the hamstring tendons, you have to use a couple of fingers to pull up towards the ceiling and then towards you, almost like you're trying to externally rotate the hip using your fingers on the medial hamstring tendons. And then you take your hammer, tap your fingers, and you can see a muscle contraction of the medial hamstrings. Also for L5, we can do Posterior Tibialis. So Nick, I'm going to have you bend this knee just so that you guys can see what's happening. So we want to first get a stretch on the posterior tib, so I would come into dorsiflexion and a little bit of eversion. Palpate for the navicular, because you don't want to hit them right on the navicular. And maybe go just plantar from the navicular. Tap with your reflex hammer, and you should see some plantar flexion and inversion. Okay, so that's L5, posterior tibialis. And lastly, the S1 reflex, and you can straighten this leg back out. Would be the Achilles tendon, so I'm going to bend your knee and bring it up towards you. Use your arm to kind of hug the leg in towards your body. Do a little bit of passive ankle dorsiflexion, and then tap the Achilles tendon, and you should see a plantar flexion response. Okay. And again, I showed you all on one side, but you would do L4 on one side, L4 on the other, L5 on one side, L5 on the other, rather than going all through one leg and then all through the other leg.